Okay, I guess it's going to take two now. So, anyway, guys, it is currently September 27th, 2018. Time is about 10 o'clock in the morning now. So, just had a phone call and had to answer that. So, my apologies. But anyway, kind of wanted to talk to you guys regarding about my surgical experience at Swedish American Hospital, part of UW Health, University of Wisconsin Health, located in Rockford, Illinois. Um, I had an MRI done on August 31st of this year of my neck. Had I had a pinched vertebrae in between two of my discs that was pinching against my spinal cord. I had to go to the ER, and I was sent by the specialist, by the um, um, neuro neuro specialist. I think of how you say it. Anyway, so was sent to the ER. Got admitted by 10 o'clock and that morning because I went down there with my mom. Um, by 3:30 in the afternoon, I was in my room. You know, IV started the whole 9 yards, and neurosurgeon came and met and greeted me, told me what was going on, what was going to happen, things like that. So anyway, I got a few pictures to show you guys. So this is probably going to be about 10 minutes long, so you guys are aware of. But I'm going to try and dim the light here just for a moment. So there's my portal. So that was along my right arm, and it did hurt a little bit, but it wasn't too bad. Couldn't look at it though, so got a few more pictures to show you guys. Day before my surgery, I was in my bed going like, oh yeah, whatever. Let's just get the show on the road. Um, the day of my surgery, the afternoon, I was trying to give the thumbs up. That I was a-okay. Surgery went well, and I was sitting upright. Probably within 45 minutes after I gave the thumbs up. So trying to feel okay. Then there's the incision. Well, there's the right where it was at. I took that myself up my neck, and because I didn't know what to expect. I was scared to death, to be honest with you. But those are all the pictures I've got for you guys. So, um, you know, and looking back on when I had surgery, this was a very major operation for me. I mean, big time in my life because I never had surgery before. It was a very scary, frightening experience, and just knowing the fact that it's something that could potentially kill me, that I may die or something like that. But this was a very major operation. Um, I was under for about 4.5 hours, give or take. Had surgery on September 2nd. Um, Rolled into the ER about 7:25. Was under by 7:30. I was in recovery by 11. So do the math. That was pretty intense. And I am going to forewarn you guys too that if you guys ever have surgery, I don't care. Especially if it's your first time. I've done this for myself, but I'm going to try and give you guys a little piece of advice is if you're ever scared, if you're sick, if you got a cold, you got the sniffles, say something to somebody, please, because that's probably going to be the best one piece of advice I can give to anybody that if you ever have surgery. Because the more that you tell the doctors, the more that you tell the nurses, the more that you tell people, guess what? They're going to be proactive in order to treat you better. And I'll be honest with you guys, I was scared to death. I mean, I was bawling. I mean, I hate to say it, but 25 years old, I was bawling right when I entered the OR, and I had a couple of wonderful nurses that were talking to me, and I already told the anesthesiologist, listen, I'm scared. I don't know what to expect. I'm anxious. I'm a nervous person as is. So the monitors are probably going to be, my numbers are probably going to be off the charts, probably for a few minutes, and the anesthesiologist, I forgot her name, but I had a female, and she said, well, I'll give you something to relax, so don't you worry about that. I'll just worry about getting you transferred over to the operating table, and we'll hook you up to all the monitors. I'll give you something to relax you, then I'll put the gas on, and you'll be put under. Okay, we'll go from there. And I said, okay. So I didn't have my glasses on, obviously, so I did have a gas mask on that they did give me. No, it was not flavored, which unfortunately it was. But anyway, I already had an IV already plugged up to me the day before, so that was great. The anesthesiologist gave me some relaxing. I'm not exactly sure what it was, so I couldn't tell you, but it did help me to relax me. It really wasn't too intense. They did put the mask on me, and I remember that the outer ring was green, so no big deal. It's not like that I'd really be seeing it anyway. But anyway, I was taking deeper, shallower breaths because I was scared. I really didn't want to go under. I really didn't want to have the surgery, but it was life-threatening, so I had to. It was at 8.5 critical. But anyway, they put the gas on. They put the gas on me, and it was so weird that once I was breathing in the gas, whatever they were giving me, it was like I swear it only felt like 2 seconds, and I was in recovery. And it was weird because I don't remember dreaming. I don't remember hardly a thing. It was like once I entered the OR, they transferred me over. They put the IV on. They put the sensors. They gave me a warm blanket and everything. I was put under, and then someone up here was telling me, Andrew, you gotta wake up. And then, sure enough, I looked around and I was in recovery. I knew right where I was at, and it was like, oh. So the nurses were asking me. The neurosurgeon was right there, and she, apparently I was talking to her before my eyes fully were wide awake from what she told me, and I said, yeah, you were telling me about when you had wisdom teeth extraction that you were bleeding like a fish. And I said, yeah, I was bleeding like a fish then. And she had said, you barely bled at all, but we had blood on standby for a transfusion just in case. But your blood pressure was up a few times, but they gave you several medicines, and you calmed right down, and you're good. And I said, that was it? And she had said, that was it. So, it's just a matter of recovery now. And I said, okay. So they wheeled me back to my room, and my mom was there, my grandparents were there, and it was very thankful. It was very comforting and soothing to knowing the fact that my family was there. And they did say, it would be a few days, if not the first 48 hours was probably the most critical. Just wearing off from anesthesia is all. And to be honest with you, that anesthesia was actually really good. I did sleep quite a bit, which is really normal for somebody having the operation, and just knowing the fact that, yes, I was anxious. Yes, the anxiety was building. I was an anxious person as is, but I told the doctors, I told them what was going on with me mentally. I was fighting a cold. I had the sniffles. I was coughing, and they said, we'll take care of you. Don't worry. I said, okay. And I had several nice nurses, blood pressure, and just overall the morality and the comforting and the compassion and the dedication that the nurses had while they were taking care of me was overwhelming amount of support. And I got a couple other things to show you guys. When you guys go to the hospital and they look at your charge, they'll most likely put you classified what they call a high risk, meaning is that you have a higher tendency to be falling. They're going to give you these special socks that have rubber grippers on them at the bottom of the feet. So anytime that you get out of bed, that you need to walk to the bathroom or something, you are required to wear these by the hospital staff, just because of the nature of the anesthesia and the type of surgery that you're going to be having, just as a whole. And something else too is that I'm not going to unravel these, but this is almost similar to like what, I hate to say this, but almost like pantyhose for men and women, because these are essentially socks that will go underneath these rubber gripper socks, but these are to prevent blood clots in your legs. Just because that you're laying down in your bed for hours and hours on end without getting any exercise, and just as a whole, your legs are going to get pretty sleepy, and you're really not going to be doing much, especially after surgery. So you're going to be required to wear both of them while you're in bed, especially. If there's any issues at all, ever in doubt, just say something to them. Just tell them what's going on. If you're running a temperature, if your stomach doesn't feel well, whatever, say something to them. I had to take like 4 or 5 different medications while I was in the hospital alone. I took a multivitamin, I took painkillers, I took a stool softener, just because I have that on a pretty regular basis. And I also I had one other type of medicine as well. I think it was some sort of like allergy pill or something. I can't remember. Some sort of cold medicine. That's what I had to do, and I had to take that consistently for like once every 4 hours at least. The pain med I was able to skip a few times. The cold medicine I really couldn't skip hardly at all. Just maintaining normal regularity. That was the biggest thing. Something else too that I'm going to tell you guys is that when you're in the OR, you're going to get 2 things, and guys, this is going to be so uncomfortable. I'm not going to lie to you. Number one, just about everybody's going to get an IV just so that they can push the medicine inside your body. Number 2, I had never experienced this before in my life, and I hope I never experience it again. Guys, you're going to get a catheter inside you, but it's both good and bad. Just because you guys know what the catheter does. It drains the urine out of your bladder. It is it can be quite uncomfortable, but at least where I was at, when they took it out, I had one really nice nurse, and I think her name was Rachel, and I asked her, please forgive me, but how old are you? She had said 26, and it's like, oh my gosh. And she took it out, and it was like, okay, we're going to maintain your dignity, and I'm going to maintain your privacy, but I have to do my job. And I said, I understand. So she took it out, and it was uncomfortable, but I'm glad that when I was under, they put it inside me. But anyway, as an adult, you cannot wear underwear at all inside the OR. You cannot. It's for safety concerns, and just because they have to put the catheter inside you. So those are a few rules. No eating or drinking at least 8 hours before your scheduled surgery time. Just the biggest thing is come mentally prepared. Be prepared to fill out lots of paperwork, and just drag your patience out, because it is going to be long, it's going to be grueling. One other thing I wanted to mention to you guys too is, I don't know if you guys had seen there in a couple of my pictures or not, but I brought this along with me. It's my little stuffed cat. It never said a word to me, but I could not take it into the OR with me. I couldn't. Okay, I had to leave this in my room, but I brought this as a comfort I am from home. Okay, and they understand, because it's a very traumatizing event for a lot of people. I'm going to remember this probably for the rest of my life. Just knowing the fact, what's happened to me, and understanding that, just knowing the fact that there was a possibility that I could have died, and too many unknowns, and didn't want to, didn't want to have MS, didn't want to, I really don't want to give up church home, but just didn't want this whole surgery experience was different. It was a new experience for me. As a whole, would I recommend SwedishAmerican Hospital to the average person? Absolutely. Just knowing the fact that they were compassionate, they were kind, they were respectable, and just understanding that everybody goes through a hard time in life, and this was my hard time. And I was very grateful for anything that they've done for me. And that day right after surgery, I had 2 nurses that they were willing to walk with me, and I'd done 8 laps consistently without any help, without anybody getting a hold of me, without any assistance at all, and just being able to walk around and stretch my legs and just feeling good. And I had several compliments. Is that, wow, you're doing really good, especially after surgery. Well, when you're cooped up, you gotta do what you gotta do. I brought my tablet along. I watched a lot of YouTube while I was there in the hospital. I watched Cops. Watched Bar Rescue a couple times, which are my favorite shows, by the way. And just, it sucks is that I still can't go back to work. It sucks I still can't shoot. But dealing with this whole surgery experience, I hope I never have to go through it again in my life. But do I regret having surgery at this point? No. I regret that I didn't say something to my company earlier, but, as a whole, my company has been great to me, especially dealing with this whole surgery experience. I've told them what's been going on, been telling the appropriate people. The only bad part about dealing with all this is dealing with insurance and paperwork, dealing with my company, and that's it. As a whole, I think it's been pretty good. So, I don't want to wish this on nobody, but I don't regret it. It's been a very, I won't say traumatizing, but a very emotional time for me. Last week I had a couple of depression spills. I really didn't want to do anything. I could barely get out of bed because I was so depressed. And just knowing the fact that I still got a long ways to go before I can go back to work. And I'll be out of work now for about 5.5 months before I can go back. So, we'll see. So, but anyway, this video is almost 20 minutes long, so on that note, I'll let you guys go. Just let me know what you guys thought about the video down below, please. If you guys got any questions regarding about Swedish American Hospital, I'll try and answer them to the best of my abilities. If I know the answer to the question. But, just take this, learn from it, and understand that everybody has to go through something in their life. And this was a big thing for me. Just knowing the fact that I'm doing better, I'm trying to get healed up, I'm trying to get back to the road. And that was one thing that my neurosurgeon did emphasize to me, is that whenever you're fully healed, you will be able to return to work. The only problem that you may have, though, is you'll have a 160-degree view. You won't have a full 180-degree view for the rest of your life. And I can live with that. That's actually not too bad. So, you can return to the road once I make a relationship, but it won't be at least for 3 months. That's average time length for recovery on something like this. So, anyway, on that note, you guys take care, stay safe, and I will see you guys later. Peace.